The Offender Personality Disorder Pathway is a national network of services, all the way from the high security estate through to medium secure, which is where our services are based, and then into the community with the National Probation Service. Our role is really to work with people who are in the criminal justice system, where those offences are linked to their experience of personality disorder. Well, the idea was really to bring both the NHS and the criminal justice system together in order to work with a population of people that are considered very difficult to reach. The prison system is able to keep them securely, but it's not particularly able to treat their psychological needs. It allows people an opportunity to access treatments, courses, to access education that allow them to demonstrate that they're now capable of managing their own lives more successfully, but reducing specifically their ability to cause harm both to themselves and to members of the public that they might encounter in the future.
Forensic personality disorder, it's really about someone's personality, and it's to do with their ways of engaging and relating with the world, with themselves, with the people around them. Often it comes out in relationships, so it could be relationships with their family, it could be intimate relationships, it could be relationships with a friend. In terms of the forensic stuff, that's often then someone who has committed some sort of an offence, is either under probation or is in prison, and is then looking at the relationships and some of the difficulties that they might experience in that environment. So specifically for our service, it's looking at the guys that are in some form of crisis. Often that is manifesting itself with self-harming behaviours, repeatedly violent behaviours, or being quite disruptive in whichever environment they are, trying to understand where that's developed from, and then thinking through with those individuals about what changes they could make to be able to manage that better. There often isn't a cure, a pill to be able to take, or a particular program to run through and then that's it, because this is really going to be an ongoing, lifelong difficulty that someone might experience, and it's about developing better ways of being able to cope with that.
So in terms of our service users, everybody's really different. Everyone's got different needs and different backgrounds. Very often there's a lot of trauma and a lot of difficulty in people's backgrounds because they've developed personality disorder traits, and they've also got serious offending histories as well.
I think for some people, they have been in a lot of services by the time they reach us. However, for some people it is quite daunting and it's quite new, and it can be quite different for them to have to talk about their personal problems, personal difficulties, and sometimes about the crimes they've committed. So it can be daunting, but what we do is we support them and encourage them about this is part of a treatment pathway and a journey, and it's about developing a good working relationship, good therapeutic relationship with them, and working towards them trusting us to help them to share their problems, and us to help them try and overcome those barriers.
So we wouldn't work with somebody for more than 2 years, but it is quite a long period of time, and that's in recognition that personality traits are difficult to change and they do require additional support. So we'll have the goals that they would like to achieve, and we'll review it every 6 months in a formal way, with the view to helping them move on at the earliest opportunity.
There isn't one route into our service, but people come in a variety of ways. Sometimes that's through our enhanced support service, which provides very short-term care to people in crisis who may then be referred into our assessment and treatment service. And we've certainly had people in that service then who've progressed onto our what's called a progression pipe, and that service is designed to help support people who've completed high-intensity treatments and are looking to try and move on either to open conditions or the community. And those services are all housed within HMP Wayland.
So we are very much collaborative, not only with these other organisations, but with the service users that we work with. So within ESS, for example, we've got a range of different skill sets. So we've got a mental health nurse, we've got me as a forensic psychologist, we've got a prison officer, and we've got a research assistant psychologist. So 4 very different roles, but coming together as part of one team. So there is that sense of it being a true collaboration, as the pathway really should be. We are one pathway, which I think is lovely, and it's often what we would need for the service users that we work with, because they've got such complex needs. So I think being able to have that, definitely you would develop that as someone working within the service, but I think you develop loads of other things as well. You can't not be curious about new ideas. You can't not have enthusiasm and an excitement when you've got these brilliant people around you who are doing such wonderful and quite often innovative things. I'm very fortunate in terms of the team that we've been able to get here, both within the Enhanced Support Service, so ESS itself, but I think the wider OPD pathway, we work with some really brilliant colleagues who are hugely dedicated, massively professional, can gain a huge amount just in terms of working with them and understanding some of the things that they've been through and some of their professional advice.
Coming in as an assistant psychologist, you can sometimes think, you've got to come in and know everything straight away, but actually it's fine to ask questions. And I think as time's gone on, I've just realised that the best thing to do is learn from the people around you. I'm working with clinical psychologists, forensic psychologists, and so many different people in different roles, and just being able to ask them, learn from their experience, has helped me develop myself.
Working with personality disorder is challenging, and it requires people who can be very flexible and adaptable in their mindset. And I think it encourages psychologists and any other clinical staff working with this particular client population to think about their own responses to difficult situations and difficult interactions. Staff who tend to do well are those that can learn emotional resilience, not personalising a lot of the difficult things that happen around them.
Having that understanding of what pushes your buttons, because there's always things that push your buttons that might upset you or make you cross. So you have to have a really good understanding of yourself.
The interactions you have might not always be rewarding on the surface level, but when you look at the deeper meaning behind them, they can be really rewarding. Monitoring your emotions in these interactions and making sure that the way you present yourself is in the best way for the service user, making sure that you kind of keep your own emotions in check and you have that ability to keep reflecting on your own personal emotions in that situation to make sure that you're bringing out the side of you that is the most therapeutic.
And I think what people can learn in this field is that people with personality disorder are just like us, just people. We've all got problematic traits. So I think it's important that people can learn that. And the same with people with offending histories as well. They're human beings, and there's reasons why they've done the things that they've done. And that psychologists, as well as other professionals, can have a really big role in reducing reoffending and supporting those offenders with their own mental health, and supporting them to live a good life that's meaningful to them.
So it is challenging, but I think in the challenge is also the bit that's amazing, because we get to be able to work with people that are often in the darkest places that they're ever going to be in their life. And therefore, if we can provide some support, the effect that that can have is massive. And it's those wins, it's seeing someone being able to progress, it's seeing someone being able to stabilise out of a really difficult experience that they might have, and then starting to see them flourish. So that hope that you're able to see and hopefully engender in someone is amazing.
If you're able to just develop that relationship with a patient and come to some sort of agreement and mutual respect between each other, this job role is perfect for that, because you get to work with somebody on that one-to-one basis. Just day to day, you're teaching people to try and think differently, live differently in such a challenging environment, and actually that's so rewarding at the end of it, because you think, actually I've helped that person just have a shower a day or think about something a little bit differently that day, not start shouting at somebody for a minute. So it's yeah, definitely better.
We've built these services up from one initial service now to 5 different services. We have a range of interesting projects on the go at any one time, and these have included environmental gardening, more clinical projects around developing new treatment models, but also we've had a number of very innovative projects where we worked with prisoners to grow their own food, to harvest their own food, and then to develop the skills to cook their own food from scratch.
Yeah, it's really exciting to be part of a developing service. We are a small team at the moment, but we all work together and we all have an input into developing what it's going to look like, evaluating how it's going, getting feedback from people in the service, and we work together to make sure that we're providing the best service that we can.
It does very much feel like a thriving service. We've been able to set something up, but we want to be able to expand and do more things, and there is that within the team, a lot of excitement and motivation around moving things forward, thinking about where are we going to be able to move that onto. And again, that's quite exciting. That's not set in stone. There's lots of different areas in which we could expand into, and want to be able to harness the sort of the creative vision of lots of the different members of the team to think, well, where could we go?